The American South in the early 1900s. There is poverty, and there is a dreadful new disease killing 5,000 people a year. It is called pellagra. The Public Health Service assigns Dr. Joseph Goldberger to find its cause. Goldberger, a commissioned officer in the Public Health Service, carefully, meticulously studies the disease, visiting the orphanages and prisons where pellagra strikes most often. Most doctors believe the disease results from infection. Goldberger injects himself with the blood of those with the disease. His findings are startling. Poor diet, not infection, causes pellagra. Pellagra is conquered by inexpensive diet supplements. This is the centennial year of the Commissioned Corps of the United States Public Health Service. For your health and well-being, 100 years and still serving. During World War II, the armed forces found that tooth loss was the #1 reason for rejecting recruits. Nearly all Americans suffered from tooth decay. Something needed to be done. For more than 10 years, Public Health Service Commissioned Officer Dr. H. Trenley Dean had been researching the effects of fluoride on teeth. By 1942, tests showed that fluoride seemed to help the body resist tooth decay. In a citywide test in 1945, Grand Rapids, Michigan added fluoride to its water supply. For 15 years, researchers studied the city's school children. They found that tooth decay was reduced by as much as 65%. Dr. Dean and his team had won a major battle against dental disease. This is the centennial year of the Commissioned Corps of the United States Public Health Service. For your health and well-being, 100 years and still serving. Rural Kentucky in 1912. A high percentage of the population suffers from trachoma, a serious contagious eye disease that can cause blindness. It's so widespread that one resident says you can't throw a stone in any direction without hitting sore eyes. Dr. John McMullen, a member of the Commissioned Corps of the United States Public Health Service, takes a team to the rural hills and valleys of Kentucky. A hospital and 11 field clinics are established. He and his team teach personal hygiene to local residents to stem the spread of the inflammation. Within 10 years, the number of trachoma cases is reduced to just 2%. John McMullen continued his fight against trachoma throughout the rural Midwest during the 1920s. This is the centennial year of the Commissioned Corps of the United States Public Health Service. For your health and well-being, 100 years and still serving. Could a virus cause cancer? In the 1950s, few researchers in the scientific community believed it could be possible. One who thought otherwise was Dr. Sarah Stewart, a pioneer in viral oncology. Dr. Stewart began her career as a bacteriologist and later went to medical school. She was the first woman to receive an MD degree from Georgetown University. She then joined the Public Health Service Commissioned Corps and became a medical director at the National Cancer Institute. Dr. Stewart and Dr. Bernice Eddy of the Biologics Control Laboratory at the National Institutes of Health found that the polyoma virus could cause cancerous tumors in animals. It was a breakthrough in cancer research. In 1965, President Lyndon Johnson honored Dr. Stewart for a lifetime of achievement. This is the centennial year of the Commissioned Corps of the United States Public Health Service. For your health and well-being, 100 years and still serving. In the early 1900s, the Bitterroot Valley of Montana is the site of a newly identified disease, Rocky Mountain spotted fever. The fever is transmitted by the bite of a tick and is frequently fatal to humans. United States Public Health Service Dr. Thomas McClintock goes to Montana to find a way to control the spread of the disease. Tick-infested livestock are run through vats containing a chemical solution to kill the ticks. As he searches for a way to fight Rocky Mountain spotted fever, McClintock is infected by the disease. Knowing his odds for survival are slim, he boards a train for Washington to see his bride of 5 months one more time. He died on the evening of his return. Thomas McClintock's service to his country and death in the line of duty were recognized by an act of Congress. This is the centennial year of the Commissioned Corps of the United States Public Health Service. For your health and well-being, 100 years and still serving. America's entry into World War II saw the country faced with a shortage of nurses to serve in the armed forces. Thousands of women had to be recruited and trained quickly. The Cadet Nurse Corps of the United States Public Health Service was the answer. The Cadet Nurse Corps was headed by Senior Nurse Officer Lucille Petrie. In return for their free education, students pledged to serve in the military or essential civilian service after graduation. More than 170,000 women received their nursing training in the Corps. The last class was graduated in 1948. Corps Director Lucille Petrie went on to become Chief Nurse Officer of the Public Health Service and later became the first woman to be appointed an Assistant Surgeon General. This is the centennial year of the Commissioned Corps of the United States Public Health Service. For your health and well-being, 100 years and still serving.